Feeling stuck, exhausted, or hopeless? And then hearing about a new drug that works in hours instead of weeks? Sounds too good to be true, right? Science is moving faster than ever. Emerging treatments, including recently approved medications and Phase 3 trial drugs, are targeting the brain in completely new ways, beyond serotonin and dopamine. Today, we're breaking down the latest depression drug updates, explaining how they work, the pros and cons, and what it really means to have treatment-resistant depression. By the end, you'll know which breakthroughs could transform mental health care in the near future. Before we dive into the drugs, let's clarify a term you'll hear a lot: treatment-resistant depression. This is when patients try multiple antidepressants, SSRIs, SNRIs, or other standard options, but still don't get enough relief. It's not about failure, it's about biology. Different brains respond differently to chemical pathways. That's why new drugs are exploring mechanisms beyond serotonin: NMDA receptors, glutamate signaling, GABA modulation, and neuroplasticity. In plain English, these are ways your brain communicates, adapts, and rewires itself, and targeting them opens doors that old medications couldn't reach. Let's start with the drug that changed the conversation: ketamine and its FDA-approved cousin, esketamine. Originally an anesthetic, ketamine acts on NMDA receptors in the brain. Think of NMDA as a gatekeeper for glutamate, the brain's main excitatory neurotransmitter. By modulating NMDA, ketamine can rapidly increase synaptic connections, boosting neuroplasticity, and that's why it can relieve depression in hours instead of weeks. Esketamine, available as a nasal spray, is now widely used in clinics for treatment-resistant depression. Pros include rapid onset, often within 24 hours, which is revolutionary for patients at risk of suicidal thoughts. Side effects can include dizziness, dissociation, elevated blood pressure, and nausea, but in controlled clinical settings, it's considered safe. The excitement doesn't stop at ketamine. Phase 3 trials are testing new compounds that work on glutamate or NMDA pathways, like AV101 and REL1017. These drugs aim to retain the rapid-acting benefits of ketamine, but with fewer side effects and easier administration. AV101, for example, is taken orally, potentially making rapid relief more accessible. REL1017 is another oral NMDA modulator currently showing promise in early clinical trials. The goal is the same: increase neuroplasticity, boost glutamate signaling in key brain areas, and reduce depression symptoms quickly. Another exciting frontier is GABAergic drugs and psychedelics-inspired compounds. GABA is the brain's main inhibitory neurotransmitter. Think of it as the calm down signal. Drugs targeting GABA, like brexanolone, originally approved for postpartum depression, show that modulating inhibition can dramatically affect mood. Then there are compounds inspired by psilocybin, the active ingredient in psychedelic mushrooms. Psilocybin-assisted therapy isn't just about the chemical. It's about rewiring circuits in the prefrontal cortex, enhancing neuroplasticity, and creating new patterns of thinking. Early Phase 3 trials show dramatic reductions in depression scores, sometimes lasting months after just 1 or 2 sessions. Let's break it down. Old antidepressants mainly boost serotonin or norepinephrine. Imagine adding more fuel to an engine that isn't firing properly. New drugs are like repairing the engine itself. NMDA modulators recalibrate the glutamate system. GABA modulators reduce overexcitation. Psychedelic-inspired compounds unlock dormant connections and increase neuroplasticity. In practice, this means faster relief, more robust recovery, and for some patients, the ability to break free from cycles that traditional medications couldn't touch. These drugs work by literally helping the brain rewire itself. If you have treatment-resistant depression, these drugs might be game changers. But even patients with moderate depression may benefit, especially when traditional SSRIs or SNRIs have plateaued. Importantly, clinical trials are closely monitoring safety and long-term effects. Not every patient responds, which is why treatment personalization is key. Genetic factors, lifestyle, previous medication history, and comorbid conditions all influence outcomes. Let's be clear, new doesn't mean risk-free. Rapid-acting drugs like ketamine and esketamine can cause dissociation or out-of-body sensations, elevated blood pressure, dizziness or nausea, rare bladder or liver concerns with long-term use. Psychedelic-assisted therapy may trigger temporary anxiety or perceptual disturbances. GABA modulators can cause sedation or mild dizziness. That's why these treatments are administered under supervision, often in clinics. Safety, monitoring, and integration with therapy are key components for effectiveness. The best outcomes aren't from drugs alone. Combining these medications with psychotherapy, lifestyle changes, and mindfulness-based interventions maximizes results. NMDA modulators and psychedelics often work better when patients engage in therapy afterward, helping the brain integrate new connections into lasting emotional patterns. For example, esketamine clinics encourage patients to follow up with cognitive behavior therapy, journaling, or guided meditation sessions. It's not just about a chemical effect, it's about leveraging neuroplasticity to make lasting changes. The next wave of depression treatments is moving beyond pills. Expect personalized medication using genetic profiles, oral NMDA modulators with minimal side effects, psychedelic-assisted outpatient therapy programs, neurostimulation combined with drug therapy. The focus is rapid, precise, and sustained recovery. Researchers are exploring ways to shorten the time to effect from hours to minutes, reduce relapse, and minimize side effects. The ultimate goal? To make depression not just manageable, but reversible in a fraction of the time it takes with traditional antidepressants. Recap: treatment-resistant depression isn't a failure. It's a biological difference. NMDA modulators like ketamine and esketamine offer rapid relief. Emerging Phase 3 drugs like AV-101 and REL-1017 could expand options. GABA modulators and psychedelic-inspired compounds enhance neuroplasticity and emotional regulation. Side effects exist, but clinical supervision keeps treatment safe. Safety, monitoring, and integration with therapy are key components for effectiveness. The best outcomes are from drugs, psychotherapy, and lifestyle changes. Rapid-acting drugs offer immediate relief, but long-term success depends on integrating coping strategies and new perspectives. Depression treatment is evolving faster than ever. For patients, it's hope. For clinicians, it's tools to tailor therapy. And for the future, it's a paradigm shift in mental health care. Thanks for watching. If you found this video useful, hit like, share it with someone interested in mental health breakthroughs, and subscribe for updates on depression treatments, mental health tips, and neuroscience explained simply. Remember, depression is treatable, science is advancing rapidly, and new solutions in 2025 could change lives. Stay informed, stay hopeful, and take care of your mind.